Any health-related information on the following show provides general information only. Content presented on any show by any host or guest should not be substituted for a doctor's advice. Always consult your physician before beginning any new diet, exercise, or treatment program.
Hello, everyone, and welcome to 5 to Thrive Live. I'm Karolyn Gazella, and I co-host this show with my good friend, Dr. Lise Alschuler. As many of you know, 5 to Thrive Live began as a podcast for people diagnosed with cancer and cancer survivors. Cancer survivorship has always been our passion, and today we have an excellent guest to discuss how to create an effective cancer recovery plan. Dr. Nathan Handley is an oncologist and the director of the Integrative Cancer Recovery Program at the Marcus Institute of Integrative Health in Jefferson Health in Pennsylvania, where he is also an assistant professor in the Department of Integrative Medicine and Nutritional Sciences. But before we dig in, I'd like to thank our sponsors, beginning with Cetria, a patented form of glutathione clinically proven to raise blood glutathione levels. Glutathione is the master antioxidant and the body's primary defense against free radicals. It also helps support respiratory health. For more information, visit cetriaglutathione.com. Also, Pro Thrivers Wellness Brain, a product specifically for thrivers that contains cognizin for memory, focus, and attention, as well as other brain-supporting nutrients and herbs. You can find Pro Thrivers Wellness Brain online at pureformulas.com. There's also Pro Thrivers Wellness Sleep, which combines higher dose melatonin and other sleep supporting natural ingredients specifically designed for thrivers. You can find Pro Thrivers Wellness Sleep also at pureformulas.com. And Dr. Ohhira's Probiotics. It's a best-selling probiotic for more than 30 years, and it contains 12 probiotic strains that are shelf-stable, so no refrigeration is required because of a unique 3-year fermentation process. It's a very effective probiotic. Learn more at drohhiraprobiotics.com. Dr. Handley, thank you so much for joining me.
Very happy to be here. Thanks for the invitation.
Well, I am always curious. As a conventionally trained oncologist, why did you want to focus on using an integrative approach to cancer recovery?
Yeah, it's a really good question, one that I get a lot, not surprisingly, because it's not as common a path, I would say. But the realization for me was really that traditional conventional oncology does a really excellent job at treating disease, and that's really important. And I think it's very effective oftentimes at doing so. But when I started my practice as a conventional oncologist, I was practicing initially in like a genitourinary practice and then a general oncology practice. And I kept seeing that it seemed like there was this gap that happened. And it was this gap with respect to helping people recover as like whole human beings. So, oncology is really good at treating the disease, with surgical precision oftentimes. But then I would see patients struggling with fatigue or pain or brain fog, with significant disruption to their lives, change in their social situations. And if it was curative intent surgery or chemotherapy, they would have this fear of recurrence. And, I often felt that like these issues weren't necessarily being fully addressed, or they were addressed, but incompletely, brain fog that persisted despite seeing a variety of specialists, or chronic pain with similar outcomes, or cardiovascular disease that would arise and not be noticed. And so this interest in integrative oncology really came when I became curious about what happens after someone is, maybe someone is done with treatment. Maybe someone has curative intent therapy and they're on this recovery path. So what happens after the last scan or the last infusion or the last radiation treatment? And often there is this sense of just being kind of left alone. And this is a concept that I think has really been described a lot in some really good books in the cancer survivorship space. But also, it's not just for people who have curative intent disease. The idea of focusing on cancer recovery is really for anyone at any point in the cancer journey, whether they've just been diagnosed or they're kind of midway through treatment, or they have, metastatic disease, or they have curative intent disease. All of these individuals can really benefit from thinking about what does it mean to really recover and thrive in the setting of cancer.
It's such a good point. And one of the things why I was drawn to your work is because of the word recovery. So it goes beyond survivorship. You're looking at not just about getting rid of the cancer, but you're looking at quality of life and all of these other issues that Dr. Alschuler and I have focused on so heavily. So I want to dig in. Are there foundational aspects to recovery that you focus on for all of your patients?
Yeah, I would say there are some good foundational things. And I think of kind of this hierarchy of interventions when it comes to supporting patients. And, it's easy to start with a foundation of lifestyle and dietary interventions and things like that. But even beyond that, I think the true foundation is the physician's oath of do no harm. Doing an intervention that, is not going to cause problems for a patient, which is something that we sometimes encounter in the integrative space, unproven therapies or potentially concerning therapies that could interact with treatments. And so, one of the things that we want to do is just really be mindful of collaborating with a patient to make sure that whatever the plan is one that is really best for them. Then I would say the next level up is where we think about, diet and lifestyle and sleep and stress management and mindfulness-based interventions. These are interventions that are broadly applicable and often can be really helpful and can address a lot of issues, even if you just go that far up the rungs of the ladder. And so, a lot of this, most of these things won't be news to your listeners or to either of you for that matter. But it is really compelling how much some of these things getting exercise, the American College of Sports Medicine has pretty clear recommendations now about what that should look like for cancer survivors. Focusing oftentimes on a Mediterranean style diet, specific diet might be tailored to the patient, but some kind of general high level things are broadly applicable. And then you move up the rungs of the ladder, and then you start thinking about other complementary approaches, some of which may be, symptom specific or disease specific. And this is where I often incorporate things like Chinese medicine and acupuncture, which I think, at least on the East Coast, is really an underutilized therapy. And it really shouldn't be at this point. It really should be, I think, standard of care to incorporate, at the very least, acupuncture with a good cancer recovery program, provided it is a therapy that resonates with the patient. Mm-hmm. The data are just increasingly quite compelling. And also, acupuncture has been in historical use continuously for thousands of years. So it's something that I think could really benefit from being more integrated into the Western medicine paradigm.
Yeah, I would agree. I am a very big fan of acupuncture, even today.
Yeah. And then there may be kind of disease-specific adjuvants or supplements, depending on what the condition is. Certain herbal therapies I might consider, certain anti-inflammatory tools, depending on what someone's lab profile looks like. And so it always ends up being very personalized to kind of how a patient is presenting and what their concerns are and what their tumor type is and what their overall biology is.
Yeah, and I want to talk about the personalization and the individualization. But first, I just want to say I'm so glad that you started with the true foundation being first do no harm. And I think that one of the advantages of working with an integrative doctor is because they can identify what could be potentially harmful on both sides of that fence, correct? I mean,
Mhm.
you are well versed with the holistic as well as the conventional, so that's one of the advantages of working with an integrative oncologist.
Yeah, I think so. And it is interesting because there is often this concept that a product that is natural is a product that is safe.
Hmm.
Um, and that certainly can be true, but it's not always true. And especially some of the newer drugs can have some very specific and peculiar interactions if you're not mindful and careful about them. And that's certainly not something we want to do. But that being said, I'm by no means anti natural medicine at all. I incorporate it very heavily in my own practice, and encourage it oftentimes. And we just want to make sure it's the right thing for the right patient.
Right, it's balanced and it's evidence based, and it has to hold up to the scientific scrutiny. So let's talk about personalization. You know, how do you individualize your approach to cancer recovery? Can you give us a few examples?
Yeah. So, I guess one of the things that I really think about is thinking about what the process is. And so, the nice thing about our practice is that it's a little bit distinct because um, our new patient visits, we have quite a bit of time. We have 90 minutes for new patients and then
Mm.
an hour for follow-up visits. And so there's really, I would say the secret sauce, if there is one, is really just that we have the time and space to really get to know someone. And so the real key is starting with the person, trying to really understand kind of who they are, what is important to them, kind of what their life context is, what their social context is, what are their values, what are their struggles, what are their fears, what is their, history. We will get into things like, the ACE score, which is the Adverse Childhood Event Score, which, um, is something that increasingly we're finding has a lot of correlates with um, chronic and complex disease later in life. And so if you can appreciate that someone has had some form of trauma earlier in life, that can influence care down the road. So we start by really trying to broadly understand the person. And then we, of course, will explore the cancer type, the treatment history, the side effects. And then based on that information, we'll then go into the next phase, which is usually we start by collecting data. And we'll get a quite broad panel of labs that would be broader than what someone would get from a typical conventional practitioner, but probably similar to what you as a naturopath would consider. And so these would be things looking at inflammatory markers and certain micronutrient levels and advanced lipid panels and thyroid function and cortisol and hormones and all these things. And then, based on all of that, we put together a plan that reflects, and it's often a tiered plan, that may happen in phases based on where someone is in their treatment journey, and what their specific goals may be. So, for example, I'm thinking back to one patient I had who had a history of colon cancer, and she came to me post-treatment, was quite a number of years post-treatment, but had chemotherapy, had some radiation, and was very active and very fit, but had some persistent GI symptoms, and wanted to make sure that she was able to stay as active as possible for as long as possible. And a big part of what we found in the workup was that she was really very physically active, but she had actually had kind of significant toxicity from the chemo and radiation. And this kind of manifested in the form of something called, there's a new term that has become popular in the oncology space called treatment-induced accelerated aging, or TIAA. And so and this is basically a condition where we see that chemotherapy and other kind of cancer-directed therapies have the desired and intended consequences on cancer cells, but have the kind of collateral damage of affecting healthy cells as well. And this often will show up as, chronic fatigue or brain fog, or in her case, it showed up as significant cardiovascular disease. And so this hadn't been thoroughly evaluated. And so we found that she had some very significant calcification of her vessels, her coronary vessels and her carotids. And so we developed a plan to really emphasize that first, because that, was the thing that was going to most directly impact her well-being in the long term. Another example would be a patient who was really interested, a breast cancer patient who was really worried about neuropathy, kind of going into treatment. And, she wasn't concerned about hair loss. She wasn't concerned about other symptoms. It was just like the idea of neuropathy was really scary to her. And so we kind of developed a plan based on, a combination of kind of targeted supplementation and kind of regular acupuncture to try to be as proactive as possible in reducing that risk for her. And so, and as I said, like oftentimes acupuncture is something that I really will bring up early and often for people. But just because I am a big fan of it doesn't mean it's necessarily for everyone. And sometimes like I really do push it and try to convey why I think it's important and valuable. But if someone tries it and like it's not resonating with them, then, like we go a different direction. And so it is really important to have this ability to be nimble and flexible and adaptive to what is resonating with the person in front of you.
Yeah, those are great examples. I'm really curious. This question I think might be a hard one, because how do you deem success? How do you define success? I mean, you're a doctor. I'm guessing you're going to say, well, it's based on the outcomes, if blah blah blah. But are there other factors that influence your definition of success?
Yeah, I think so. There are like the clear things that we think about when we think about the success of a recovery program, and those are things like, sure, like fewer symptoms. Does someone have improved symptom burden? Is it better lab values? If someone is coming in with, markedly elevated inflammatory markers or significant evidence of mitochondrial dysfunction or oxidative stress or something like that, then, demonstrating that you can improve some of those values is really important. But I think even more important than that is, is something that is a little bit more qualitative and nuanced. And that is, in many ways, I think perhaps the most important thing that we deliver in a cancer recovery program is this idea of feeling seen, having a place where patients feel seen and heard and not discounted or even gaslit. Because, I see this over and over again, like patients who have maybe they've been cured of their cancer, and then like the story is over for the conventional treatment, but the story's not over for them. Their life is still going on. And it's very common to, feel so supported. And then, like go to the classic example of you ring the bell for radiation and then everyone's done. And then your friends and family aren't asking about it anymore, but like you're still having symptoms and not feeling seen or heard. And so like the key piece is having people feel supported. And And then another key piece is helping people feel empowered, feeling like they have the agency to take control of components of their health, which is not to say that they have the power to keep their cancer from coming back or progressing or things like that, but to really have agency in their own lives. I think that's a hard thing to demonstrate, but it's definitely something that you can feel and see when patients experience it. And so with that can come improved quality of life, which you can measure. With that can come confidence in managing long-term health. With that can come reduced fear and uncertainty, which you can also measure. And then, the qualitative stuff, the things that you can hear from patients, people saying things like I feel like myself again, or I found this new version of myself that I can live well with. And so those are some of the general things. I think at a programmatic level, we think about, are we collaborating effectively with colleagues? Is this a multidisciplinary thing? And I think one of the challenges that integrative medicine can fall into is that it is intended to be this integrative modality, but it can become siloed too if you're not careful. And so, it's really important that that we see ourselves and patients see us as, part of the bigger picture. And something that is, and so another part of that is like, how effectively are we really integrating into standard cancer care? Are we being good colleagues? Are people referring to us? Are we referring back to other patients? Like, is this viewed favorably by other members of the care team? Because that's also important. Another challenge, I think a big challenge in the integrative space is accessibility and equity. So ensuring that this can become a way of treatment that is broadly available. And that remains a challenge. And I would say that's probably one of the biggest challenges in the integrative space right now, because of kind of current reimbursement models. That makes it difficult. And then another thing is, like, are we focusing on outcomes that patients actually care about? And so we can talk about those like qualitative, felt sense things like, oh, I feel like myself again. But like, are we moving the needle meaningfully for patients? And so that's kind of a long list.
Yeah, well, I'm just glad that you mentioned some of the measures of success that are hard to quantify. That's kind of what I was looking for. So I'm glad that you mentioned those. And now we only have a couple minutes left. What would be a factor or a couple of factors that most influence cancer recovery success in your mind?
Well, I think one of the things that is kind of in many ways unique to like our Western culture, is this idea of rugged individualism, like, pull yourself up by your bootstraps, like you can be anything you want to be. And there's a lot of value to that. But it can be an isolating perspective. And so, oftentimes the thing, like when we're doing an intake for a new patient, the thing that I look at most is like, what is their support system? Not only from a medical standpoint, but from a social and emotional standpoint. And do they have a community that they resonate with and is deeply important to them? It's interesting, even if you look at that outside of the oncology community, like if you look at some of the newest longevity science, like if you look at the blue zones or anything like that, the probably, I would say, if you ask any of those experts, what they would call out as the most important thing, it would be having a sense of meaning and purpose in a strong community.
Mm-hmm.
And that's a hard thing to create, but it's a good thing to look for. So that's one thing. I think another thing that can really influence outcomes, you asked for one, I'll give you one other, is that is basically asking, seeking care early, not waiting until problems are really severe, but kind of looking for care that you think of as important and meaningful. And so like the earlier the better for thinking about cancer recovery. Like you don't have to be suffering to engage with it. Like it can happen at any moment, and you can be suffering to engage with it. Like doesn't mean like it's not going to be helpful. But proactivity is really, really key here too.
Well, and I would think that proactivity and seeking care early is important with recovery as well. So once the cancer is done, like you said, conventional treatment sometimes pats the person on the back and says, good luck with that.
Mhm.
So in transitioning from cancer treatment to cancer recovery sooner rather than later may be important.
Yes, totally agree with that. Yeah.
Yeah, well, great.
Yeah.
Well, Dr. Handley, this has been great. Lots of great information. You're doing wonderful work, and let's have you back on the show because you brought up several issues that I'd like to discuss in the future. So I'll be in touch with you about that. So thank you again for joining us and talking about this important subject.
Well, thanks so much. It was a real pleasure.
And once again, I'd like to thank our sponsors: ProThrivers Wellness Sleep Formula, ProThrivers Wellness Brain Formula, Cetria Glutathione, the superior glutathione to support liver and immune health, and Dr. O'Hara's award-winning shelf-stable probiotic. Thank you for listening, and remember, you can find past shows at ithriveplan.com or wherever you listen to your favorite podcast. We are on all of the major podcast outlets. Thank you so much. May you experience joy, laughter, and love. It's time to thrive, everyone. Have a good night.